And what about late local recurrence? 10% of all local recurrences arrive after 5 years. And this is a similar graph to the metastases one, just showing that the percentage risk of local recurrence per year can be worked out based on all this information. So very high risk patients, 19% risk in the first year, dropping to 15% in the next year, and then gradually decreasing. And even low risk patients have a small risk that gradually tails off. So all this data can help us plan how you might follow up patients. I don't say I got the answer, but big data analysis like this can help you plan and make you discuss with the patient what the likely risk is. And it means that we can start to individualize patient follow-up. Thank you.
Thank you, Dr. Kramer. Our next speaker is Dr. Andreas Leithner, with the title of Rethinking the Follow-up of the Soft Tissue Sarcomas, a multicenter study analysis of 835 cases.
Mr. Chairman, ladies and gentlemen, thank you. So we stay with follow-up, but focus on soft tissue sarcoma. The ESMO guidelines tell us that while prospective studies are needed, a practical approach in place at several institutions is as follows. High-grade patients may be followed every 3 to 4 months in the first 2 to 3 years, then twice a year, up to the 5th year, and once a year thereafter. And in Austria, we stick to the ESMO guidelines. So this is what we do in Vienna and in Graz. So for the first 3 years, we follow them quite closely, and afterwards to 6 months and 12 months. But the question is this cost-effective, and is it really necessary? And there are 2 famous guys. First is Rob Grimer, of course. I think a lot of years ago, he proposed a randomized study in Birmingham and to randomize between standard intervals and longer follow-up intervals. But as he told at a conference, this was chosen to be unethical, and it was not approved. And the second famous guy is, of course, Ajay Puri, who did this study then in India, and he checked on surveillance after survival of the surgery for sarcomas, a randomized non-inferiority trial on bone soft tissue sarcomas with 500 patients, for example, just chest X-ray against CT, and also 3 monthly intervals against 6 monthly intervals. And there was really no difference. A 6 monthly follow-up regime was not inferior to a 3 monthly follow-up regime in terms of detecting metastasis and local recurrence. And even more, 56 of the 63 local recurrences were identified by the patients themselves who were symptomatic. So the question for us is our follow-up regime adequate? We're looking on the rate of local recurrence distant metastases in a retrospective cohort, using a prediction of time-dependent rate, using flexible parametric time-to-event models. This is a quite new statistical technique. Flexible models can directly model on the log cumulative hazard scale with spline functions. They can accommodate non-constant hazards and accommodate time-dependent effects. 4 centers, 835 patients, mainly about 80% G3 sarcomas, histologies, liposarcomas, myxofibrosarcomas, everything else. And please look on the right graph. This is the event rate per 1,000 person years, and you see quite closely what we all know. So the most events concerning local recurrence in blue and distal metastases in red happen within the first 2 to 3 years, and then they really go down. So this doesn't really help us concerning changing our follow-up regime. But if you look more closely on histology, for example, and on grade, so grade is no surprise at all. The high grades do worse than low grades. But concerning histology, there's a big difference between, let's say, myxofibrosarcoma and liposarcoma, for example, excluding the ALTs. And if we stay with local recurrence, or if we go to local recurrence according to grade and histology, there again is a big difference between MP and ST, for example, with a high recurrence rate, and, for example, myxofibrosarcoma with a little bit lower recurrence rate after the 2nd year. So how long, and this is how low has the risk of distal metastasis in local recurrence to be for us to accept longer control intervals? And this is a really difficult question each of you has to answer. And just to give you some outlook what we're doing at the moment, this is preliminary data with now 2,460 soft tissue sarcoma patients, because the Leiden group has included all the Dutch soft tissue sarcomas, and we also got the Italian soft tissue sarcomas. Maria Small is doing the analysis. And this is, for example, the rate per 1,000 person years, again, all subtypes, grades, and margins. And the rate of local recurrences decreases sharply at the beginning and then stays rather constant over time, so like we've seen in Rob Grammer's talk. But the rate of local recurrence depends mainly on histology, and this is a really interesting graph, but again, this is preliminary data, and this is calculated with a flexible parametric survival curve. We still do not understand this graph. It might be the local recurrence that the R2s maybe get more radiotherapy. So there's still some discussion concerning these graphs and also these graphs, because the G2 have a higher rate of local recurrence than the G3s, maybe because more radiotherapy is given to the G3 sarcomas. But again, this is preliminary data. So in conclusion, flexible parametric models can help us to study of time-dependent local recurrent and distal metastasis rates in soft tissue sarcoma. They're easily usable for individual aftercare. Rates of local recurrence and distal metastasis are highly non-constant over time. There is a strong variation by prognostic determinants, and I think one size does not fit it all, so one size, one kind of follow-up for all those soft tissue sarcomas is not really a good choice. This metastasis aftercare, according to the Callegro nomogram, is a very nice publication, should be used according to our opinion. Targeted aftercare, considerable reduction in scans. And for local recurrence, we're just at the moment checking with apps maybe, so if you put in everything and the app then tells you what to do and what kind of aftercare you should do. And again, let me invite you to next year Florence, Amsos, and after this in Graz 2020. Thank you very much.